Yes. A warm welcome, students. How are you? So, welcome to all. Okay. So today before going to the topic. Just wait a second. Okay. So I hope you had your breakfast and you came fresh to the class. Okay. Yes. So today we will be seeing a very interesting topic. I know this topic you would have already learned in your biochemistry classes as well. Okay. This is just a revision of your biochemistry classes. Okay. On this particular topic of water soluble vitamins. So vitamins are very important for our day-to-day activities, day-to-day routine functions, biological activities, many such. Okay. So my point of view is I will be integrating this particular topic of water soluble vitamins into our subject of public health. How we can diagnose the disease at the primary level, grassroots level, all we will be seeing this at this stage. Okay. My motive is to clear all your as a primary physician, when you're appointed in your PHCs or your CHCs, and when you able to see this vitamin deficiencies cases, you should be able to pick up at the grassroots level itself. So that will be very useful for that needs avoids like unnecessary referral of cases and such things. Okay, without any further delay, so we will be teaching our class. Okay, I want everyone to cooperate very much. Well, this will be a very much interactive session, and this is one of the most important asked question in your 10 mark or 25 marks. So that it will be a part of a 25 mark answer, like an essay, or it can be a separate 10 mark question as well. Okay. So without any further ado, so listen to the class. Well, I want everyone to be cooperative, take the notes adequately, so that you don't need to go back and prepare back in your books. Okay, all the contents will be there in your. So listen to the class very carefully. Okay, so myself is Dr. Melvin James, from the senior resident from the Department of Climate Medicine, teaching you the topic on water soluble vitamins. Okay, so we'll take an example. Okay, COVID as example. You know that during this COVID infection, that is during the pandemic times, where we are actually very much undergoing this lockdown effect, many things. Okay, at that time, we are prescribing left and right vitamins. You could have seen that many of your relatives or daughters who are being affected with the COVID have been prescribed about this vitamin C and vitamin D's all over the things. And as I wanted to emphasize the fact that vitamins are one side, it is useful. On the other side, if it goes to the side of overburden, over dosage, and it can also go to the effect of hypervitaminosis. Okay, so that's why the people from WHO or Ministry of Health and Family Welfare tells that stops the indiscriminate use of vitamins, similar to what you can say that injudicious use of antibiotics. So if you are not giving this antibiotics properly, what will happen? Yes, the person who's getting that can develop something called as resistance. Okay, so you have to know that where you have to prescribe these things and then what dosage and what duration that you must know, so that it can act as a double-edged sword. So vitamins can act as a double-edged sword. Remember, one side you can see vitamin D deficiencies. So where you can get this vitamin D, anyone know? Yes, vitamin D can be getting we will get from sunlight, directly sunlight. Okay, those things they have a newspaper article which tells that vitamin D deficient kids are prone to severe form of COVID. They are actually lacking that when they are affected with COVID infection. They are saying that they lack this particular vitamin D. Okay, now we will see what vitamins we are giving from each thing, each vitamins. So we are having vitamins like fat soluble and water soluble. Okay. So what do you mean by vitamins? So you know that vitamins, but whenever you are asked in a viva that uh, like define vitamins or define minerals, like that you will be stuck in a chaotic way. Okay, so that this is a definition just given in the books like vitamins are nothing but essential micronutrients. Remember, the word essential is very important. Okay, essential means that is must need to be the for the body to function on a day-to-day basis. That is very important. That is not like non-essential; it's essential micronutrients, which is required only in small amounts. Small amounts, I mean, is like less than grams, milligrams to grams, not in apart from that. Okay, to maintain our growth and development, biological functions, whatever day-to-day activities our body is undergoing. Okay. And next, how many vitamins we are having? You know, there are about 13 vitamins we are having. Okay. That has been broadly divided into fat soluble vitamins and water soluble vitamins. Okay. Okay. Now we tell about what are fat soluble vitamins. So that's remember like A, D, E, K. Okay. The vitamin A, vitamin D, vitamin E, and vitamin K. All your things are called as fat soluble vitamins. And all your B and C. Remember, even though there are about B complex, many vitamins. Remember, generally, B and C are called as water soluble vitamins. So next, I will tell you about what do you mean by the difference between why we are having these two vitamins as separately. I will tell. Okay, B vitamins and C vitamins. Tell me along with me. B and C vitamins are water soluble vitamins. Under the B, we are having many, it's called as B complex. We are having many group of vitamins. Generally, B and C are water soluble and A, D, E, K are fat soluble. Just remember for me. Okay. Next. So as I said, this is just like a flowchart classification, water soluble and fat soluble vitamins. Okay. And what is the difference between why do you have the separate two vitamins, fat soluble and water soluble vitamins? So what are the main differences? What it is fat soluble is, it is those vitamins which are stored in the adipose tissues. That is your fatty tissues in your body. Adipose tissues. So there will be like fat tissues in your body now. So that is called as adipose tissues. It is already stored. So it is already stored. So we don't need to have some frequent dosage, frequent intake of all these fat soluble vitamins like A, D, E, K. Okay, we don't need that particular frequently intake. It is already stored to a certain extent. We need only few amounts. Okay, but on the other hand, water soluble vitamins are water soluble. So it is excreted through our body as a like a urine line. It is already excreted in our body, and the absorption is also very simple. So we need that water soluble vitamins on a frequent basis, either from our diet or as a supplements. Remember that. Then, now I want you to tell me that which vitamin deficiencies are common. Just think for a minute and tell me. I said the difference between two. Water soluble are excreted from the kidney, but fat soluble are stored in our body. So just take a 1 minute and think that what vitamin deficiencies can be common among these two, fat soluble or water soluble vitamins. Yes. Yes, very good. So it is what always water soluble vitamin deficiencies are very common because they are not stored in our body. They are excreted through our kidney on a day. So we need that particular vitamin on a day-to-day basis. Remember this important point difference when you are asked. And the next point is like you can see that hypervitaminosis can occur only in case of fat soluble because it is stored in our body. Hypervitaminosis is more common in your uh, fat soluble vitamins than water soluble vitamins. But deficiency is common in water soluble vitamins than fat soluble. Remember this particular difference. Here I wanted to tell that vitamin B12 is an exception because vitamin B12 requires something as special complex mechanism. Even though it is a water soluble vitamins, I'm not all the other water soluble vitamins are simple absorbed. But this vitamin B12 alone, it requires something called as intrinsic factor and it's absorbed in the terminal ileum. You could have studied in your pathology classes as well. It's absorbed in the terminal ileum by through the mechanism called as intrinsic factor mechanism. Okay, so that is an exception among this water soluble vitamins. Okay, so our going to our overview, like so we'll be seeing about the chemical names, that is your scientific name of vitamins, and what are the various functions of the vitamins, and where you can get the sources about in the food, either in the food, and what are the daily recommended requirements we need, and what happens if the vitamins are deficient in these cases, and how we need to prevent this deficiencies. Okay, and finally, we will be as usual in our class. We will have a short assessment of like an MCQ quiz, so that I want you to listen to the class through. Okay, as I said, we are having some B complex vitamins. We are having some group of vitamin names. Okay, like we are having names like B1 is called as thiamine, B2 is riboflavin. B3 is niacin. B5, so I want you to write each and every one. So this is very important. You can ask about anything. B5 is pantothenic acid. B6 is pyridoxine. B7, very important vitamin called as biotin. B9, what you can say it is folic acid, that is also called as folate. B12 is cobalamin or methyl cobalamin, it's the scientific name. And vitamin C is also called as ascorbate or ascorbic acid. Okay, these are the names. And we'll see, I have categorized this presentation as general functions and specific functions. General functions, if you remember, there are only specific functions, only few. Just remember the general functions. It is required for maintaining the nerve cell function and immunity. And it is also the vitamins play a vital role in RBC synthesis. Whatever the blood cells which you are having in your body is mainly synthesized by your RBC. So indirectly, if you are deficient of vitamin, you can result in case of anemia. Okay, that is an indirect way of assessing. Okay, RBC deficiency causes anemia. Remember that. And so vitamins are also actually having a regulation of various hormones, gene expressions, and it's also regulates in your DNA replication. And mainly important in all your metabolism activities, like your carbohydrate, protein, lipid metabolism, all particularly very important is your vitamins. And major source of energy is also vitamins like ATP production. Okay. Now we are coming to the specific functions. What particularly B complex and C vitamins does. Okay, our main goal is we are focusing on water soluble vitamins. This particular classes, remember what we are going is teaching is water soluble vitamins alone. Next class we will teach about this fat soluble vitamins as well. Okay. Now B1 is specific for carbohydrate. Whatever we are intaking as carbohydrates that need to be converted to energy. That is carbohydrate to glucose conversion is mainly done. We need the help of vitamin called as B1, that is thiamine. Okay. Or generally think all the vitamin B1 and B2 are similar thing, similar actions. So remember this, if this particular B1 and B2 are not there, your carbohydrate will be not converted to your energy and you will be having what you will having? You will be feeling tired all the way, all the day. You couldn't do your school activities, your work activities, or job activities, anything you won't be able to do that. Okay, you will be very much fatigued, very much sad, everything. So this is particularly the vitamin deficiency called as B1 and B2. Okay, that deficiency we'll see in the upcoming slides. Okay, then B3. So what is B3 is? There is a good. What is a good cholesterol? Your HDL is your good cholesterol. Okay, vitamin B3 it actually increases your HDL levels and it lowers the LDL level. LDL is called as a bad cholesterol. It actually lowers the LDL levels and increases our good cholesterol called as HDL. Okay, so if this particularly vitamin B3 is not there, na, you are at higher risk of increasing your LDL levels in your body. That can result in your generation of your risk of cardiovascular diseases. Okay, so B3. What is remember B3? What is B3? B3 is niacin. Remember B3 is niacin. Now we are coming to the vitamin called as B5. What is B5? It is pantothenic acid. So then and then I will be revising all the things which we have taught in the class. Okay, B5 is vitamin pantothenic acid. It actually is requires for the synthesis of RBCs and corticosteroids. Okay, and vitamin B6. So vitamin B6 is a very important vitamin. It's called as pyridoxine. Okay. Uh, this is actually essential for your gluconeogenesis and neurotransmitter synthesis. Why I'm saying it's very important is uh, I hope you know that many people who even in your relatives or friends you would have affected with the disease called as tuberculosis. They would have taken this particular drugs called as anti-tubercular drugs. You would have read in pharmacology, na? Anti-tubercular drugs. That anti-tubercular drugs, one such drug is called as isoniazid. That does, when you're taking that particularly drug called as isoniazid, you will be resulting in a condition called as B6 deficiency, pyridoxine deficiency. So that is a side effect of this drug called as isoniazid in the ADT group of drugs. To combat this, usually the pulmonologist or the government which is clinic where they are issuing this ATT drugs, they will be giving this ATT isoniazid tablets. Along with that, they'll be giving something called as B6 supplements as tablets, so that to avoid the deficiency of B6 in the body. Okay, this I'm just integrating this clinical part into it as well. Okay, next our on the go is vitamin B7. What is vitamin B7? Okay, many students are there here. Okay, and the girls also will be there. Okay, the many cosmetic products, whatever you are using for your skin, nail, and hair care, are being rich of this particular vitamin. Okay, this vitamin is particularly rich in this. Remember, okay, all this. So, if you are having particular the deficiency of this particular vitamin, you will be resulting in your hair loss. Skin will be like dermatitis can occur. Anything. This particular vitamin is specific for hair, that is B7 vitamin. Okay, you can see like I don't want to name the products. You can see that like minoxidil, like many people are using for a hair fall. You can even see that that particularly topical applicant which is prescribed for the hair fall is contains this B7, and even tablets as well. Vitamin B7 tablets are being also prescribed for the by the dermatologist to prevent this hair fall as well. Okay, next B9 is what is B9? That's a very yet another important vitamin called as folic acid. Where you can see, remember this folic acid? Yes, you could have seen like pregnant patients who are taking this particular vitamin. Okay, starting from the pregnancy, preconceptionally, we will take this folic acids. Remember that preconceptionally we will take the folic acids, and from the preconceptionally you will be taking along throughout the pregnancies as per the recommendations of your anemia Mukbar program. Folic acid has been should be started from second. Iron and folic acid should be started from second trimester onwards. You know that iron has causes like uh, hyperemesis. So already there is a morning sickness in the first trimester itself. So that's the reason we are giving starting from the iron and folic acid from the second trimester onwards. Okay, till the 180 days during pregnancy and 180 days after pregnancy. That's 6 months. That is a recommendation being given by the Anemia Mukh Bharat program. Why I am telling is folic acid is for this particular folic acid, will it is better recommended that preconceptionally, even before planning the pregnancy, start the folic acid itself. As per the OG recommendations, ACOG, American College of Obstetrics and Gynecology recommendations, they saying that preconception folic acid is better to prevent this neural tube defect. And they are also adding a point that if the baby is already affected with neural tube defect, the previous pregnancy is having like congenital anomalies called as neural tube defect, you must definitely start the patient on folic acid tablets preconceptionally. Starting from that onwards, the dose may be varying from 400 to 500 micrograms of folic acid, and iron you don't know 60 milligram of iron, elemental iron. So this is how it is. All the vitamins are clinically correlated. Okay, and the next vitamin is vitamin B12. Okay, that is called as what's the name of the vitamin? It is methylcobalamin. That is actually required for your maintenance of your myelination of spinal cord tracts. And if this particular vitamin has been deficient, you will land in a condition called as subacute combined degeneration of a spinal cord. One of the integrity of the spinal cord is maintained by the myelination. The myelin sheath of the spinal cord has been maintained by this particular vitamin called as vitamin B12, and it has acts as a help in the hematopoietic activity like synthesis of RBCs and DNA synthesis. Okay. Now we have completed this B complex vitamins, and now we are going to the vitamin called as vitamin C. Okay, vitamin C, you know that it is an antioxidant. It inhibits your aging process and helps in tissue growth. Okay, generally I remember that it helps in wound healing. Okay, this particular vitamin when they are affected with any ulcer or anything, this particular vitamin is suggested. Okay, even in your topical applications and the tablet, they will be having this vitamin for improving the tissue growth and improving the wound healing and ulcers. Okay, remember for repair purpose because it has some collagen synthesis. And the next important clinical point is it facilitates the iron absorption. So you could know some relatives who are actually deficient of this anemia patients who are actually deficient of this vitamins uh, iron deficiency. They when they take this iron along with this vitamin C, it increases absorption. But on the other hand, you could have seen that iron should not be combined with your tea and coffee. If the pregnant patient is taking the iron and tablets in tea and coffee, it has actually called as phytates and tannins. It inhibits absorption, so it results in anemia. But on the other hand, if you take this iron tablets along with vitamin C, so now, like lemon juice, orange juice, if you take that, it actually increases absorption. Okay, that's a clinical point. I wanted to tell this on this. And now we'll have an interesting session. And like, can you know that? Can you tell me this, and can you help me in answering this question? Why we don't have this vitamin names as vitamin F, G, H, J, and P? So think for a minute. Yes. Okay. The major reason is, anyone can tell it. Yes. And we, I'll ask another question. What's vitamin M as well? Okay. Apart from non-academic way, vitamin M, you already know that. Okay, I'm not going into that in an official forum. That vitamin F is nothing but like essential fatty acids. Already the older name of essential fatty acids, which we are having now, is vitamin F, the previous name. And vitamin G is a older name for your vitamin B2, that is your riboflavin. And vitamin H is a older name for your B7, biotin. And vitamin J and P, there are many studies have said that it is not beneficial for your human health as well. Okay, it is actually benefits only for your rats, so they are not actually useful in your human health. This is the reason we are not having this vitamins, and their names are actually changed to this vitamin. Okay, and you could have, I know as a MBBS point of view, we will be facing difficult to remember all this, what are the sources of vitamins. And when you are sitting in exam hall, you will be actually, your exam mindset will be stuck. What sources of which vitamin sources are. Okay. I'll tell you a simple keyword to remember all these things. Vitamin B, B complex, remember that five things. Tell me along with me five things. Green leaf vegetables, egg, milk, meat, and yeast. Okay. All this, if you remember these five important things, tell me along with green leaf vegetables, egg, milk, meat, and yeast. If you remember these five things, these are the rich sources of your vitamin B complex. All your B1, B2, B3, B4, B5, everything. If you remember this five things, you will be the answer will be sufficient for that. Okay. And vitamin B12, especially this particular vitamin, which is actually having majority the animal sources like boiled egg, yogurt, fortified cereals, cheese, salmon, like that. Majority of animal related sources is your vitamin B12. Just remember that. Okay. And this is where I wanted to focus your attention. Like vitamin C can be, the foods are very much specific, like citrus fruits like orange, lemon, Indian gooseberries, many things, Indian gooseberries, kiwi fruits, strawberries, mangoes, all this guava, all this like citrus items of fruits are mainly rich sources of your vitamin C. Okay, vitamin B complex, generally all these five things remember, and vitamin C, any three or four remember these things in your exams. Okay, now I will telling about how the story of vitamin C has evolved. Okay, in the year of 17th century, 1747, a person called as James Lind, he has been able to treat this condition called as scurvy. How is he is nothing but a Scottish surgeon. Okay, he is a Scottish surgeon, like riding the ships. Okay, in the ship he was able to, one fine day he was able to see this many people who are dying of this condition. Okay, dying of a condition called as scurvy. So he did a very clinical trial for comparing this, what could be the treatment for this time. Okay, so he divided these patients like a randomized RCT. Like one group he divided like vinegar and other things, and one group he tried this orange juice like vitamin C related items, vitamin C rich foods. The one group, the group which he gave this vitamin C related foods like citrus foods like orange, lemon, they recovered well from a condition called as scurvy. So that has led to the discovery of this particular thing, like vitamin C rich foods helps the treatment of scurvy. Okay, from that onwards, that is a discovery made by him. Okay, then remember the name. He is James Lind, and he is also called, can be called as father of scurvy, like that. Okay, now we are coming that recommended daily allowances. How much you need to have that vitamins on a day-to-day basis. Okay, the B1, vitamin B1, about 0.5 milligram of 1000 kilocalories. B2, like same. B1 and B2, usually it is the same. 0.5 milligram per 1000 kilocalories. If you're having that if you're eating the 2000 kilocalories per day, you need something called as 1 milligram per day, like that. Okay. You need to have like mostly try to take it from the food itself so that you don't need to take it as supplements. B3 it is 6 milligram, Panther B5 10 milligram, and remember B6 is very important. 2 milligram per day for adults, 2.5 for pregnancy and lactation, 10 milligram of patient on INH therapy. As I already said, they would have been deficient with isoniazid, like B6 deficiency can occur. So you are supplementing this B6 with isoniazid therapy on ATT. Okay. Now B9, it is where in your when you're referring the part, all these are being given in your part, and not taken from elsewhere. In your standard textbook called as part, we are having this all these things recommended daily allowances. Adults, pregnancy, lactation children, about 200 micrograms we are giving. And B12, your methylcobalamin, we are giving like 1 micrograms, 1.5 micrograms, all these six. And your C, vitamin C, actually we are giving this 40 milligram per day. Okay, just try to remember this thing on a approximate basis at least. Okay. Now, which vitamin is deficient among strict vegetarians? Can you anyone tell me? Yes. One vitamin I told, remember, do you remember that one vitamin is majorly from an animal source? So strict vegetarians won't take that. Okay. So that particular vitamin is, yes, everyone is correct. That is vitamin B12. Okay. So I would suggest like those who are strict vegetarians, at least take a form of any other form in a B12 or B12 any other form like green leafy vegetables or egg, any other take only other to avoid this B12 deficiency, or else you will be given like tablets to take that. Okay, remember. Okay, are you good to go? Yes. So now we'll see some individual deficiencies of vitamins as well. Okay, the first point is vitamin B1 deficiency. It causes beriberi. Okay, wet. Here we are having like three types: wet beriberi, dry beriberi, and infantile beriberi. The wet beriberi is very much dangerous. Okay, it actually affects your cardiovascular disease. And your dry beriberi is like neural system, like peripheral neuritis and paralysis of legs. Okay, in the why I'm telling this deficiency is in the 18th century. Okay, many people are actually eating like polished rice. Okay, that has deficient that has caused the deficiency of this B1 vitamin called as, and it has led to the deficiency. And the infantile thing, when the mother is deficient with this particular B1 vitamin, the baby would, the deficient would have transferred that particular thing to baby. Like a 2 to 4 months breastfed by the deficient mother can cause like lead to infantile beriberi. And the next persons is those who are actually chronic alcoholic patients. You could have known that now when the patient is chronic alcoholic, that particular patient, the alcoholic patient would have this B1 deficiency. That is the condition led to the alcohol deficiency called as Wernicke's-Korsakoff's psychosis that will be presenting with ataxia, ophthalmoplegia, and peripheral neuritis. And this particular B1, I told it is important for your metabolism. So it has if this B1 is not there, your pyruvate will not your pyruvate is not will be converted to lactic acid. So it will actually result in lactic acidosis. And this B1 vitamin is mainly lost during your milling, washing, prolonged cooking. Whenever in your kitchen, if you are cooking the your rice for a more time, if you are overcooking the rice, this will remove this particular vitamin called as B1. Okay. Also, it's lost when cooked with the cereals cooked with the baking soda. How we need to prevent this thing means you need to cook for a very shorter time, and the another alternative strategy is something called as parboiled rice. Okay, and as usual, you should need to stop the alcohol intake. Now I will tell you what is meant by parboiled rice. Parboiled nothing like in a soaking in a steam water and drying it and using that. Okay, you know that many of you know the preparation as well. It actually preserves the vitamin B1 in the content in that rice. Okay, this is a particular video which has been showing that how parboiled rice is being prepared. Okay, everyone see it very keenly. Okay, they are washing and soaking for 20 minutes, and they are it's a soaked rice. They are transferring to a plate. Yes. Now actually they are having like boiling water, adding boiling water and heating it and checking the rice is whether cooked well or not. Okay. And they are draining the water. Okay. Yes. Okay. So this parboiled, this is like perfectly cooked rice. Okay. Then, okay, this is parboiled rice. It's the method to preserve this vitamin B1. Okay, the major merit is it thiamine get firms to the grains. It actually goes, it pushes from the outer to inner layers of the grain, right? So it like becomes like insect resistant and easy to digest. The major drawback is it has some reduced flavor, reduced taste, and unpleasant smell. Some children won't like to take this rice. And next, we are coming to the vitamin deficiency called as B2. B2, you know that arboflavinosis, one of the conditions called as angiostomatitis, glossitis, all will be occurring. Okay, this is an case of index of malnutrition. On the kilosis is nothing but you can seeing in the picture now, like aberrations like on the lips, sides of the lips. Okay, and to avoid confusion of this, I have showed a slide called a tongue signs. Okay, this is the first picture which is B2 deficiency. Okay, this is the condition called as magenta red tongue. And the next condition is this is geographical tongue. This is B12 deficiency. This is B2 deficiency. And another you should not get confused condition called as strawberry tongue, which is seen in scarlet fever. Okay, these three tongues you must be remembering lifelong for your clinical practice as well. And next is your B3 deficiency. Remember, it causes pellagra. Pellagra means 4 Ds: dermatitis, dementia, diarrhea, and death. One of the condition of dermatitis is called as Kessel's necklace, which is hyperpigmented patch over the sun exposed size. Okay, it is common in your maize or jowar eaters, where your excess of leucine blocks the conversion of tryptophan to niacin. So it is not actually directly the niacin deficiency. The tryptophan is not able to convert to niacin, so thus leading to the niacin deficiencies. Okay, you can see that this is a condition called, you can see this is a Kessel necklace. Right? And a hyperpigmented patch when when on the places of your wearing sites like necklace when you wear your wearing, you could see that hyperpigmented patch over the sun exposed sites or the persons you could see that the persons who are actually having wearing the jewelry on the side. So that particular region you can see like jewelry side. So that's the reason they termed this name called as Castle's necklace. It is in the area of necklace where this patch would have seen that. So when you see this condition in your clinic, you can find that this is your B3 deficiency or niacin deficiency, and the name is called as Castle's necklace. And one word, few words about the other vitamins. So like B5 causes burning soul or feet syndrome. B6 seizures, anemia, peripheral neuropathy. B7 I said now it's a vitamin which is mainly required for your hair related, like hair and skin care. Okay, this vitamin is causes dermatitis and hair fall. B9, if you're not taking in your pregnancy, megaloblastic anemia, neural tube defects. B12 again pernicious anemia, and B12 I said for a recommend for needed for your myelin sheath. So if it's not the subacute degeneration of spinal cord, vitamin C scurvy or swollen bleed comes. Okay, and in cases some things like multiple deficiency syndrome can occur in common, like a group of vitamins deficiency can occur like B2 and B6 deficiencies are more common in your multiple deficiency syndrome. Okay. And can anyone tell me what is this? I have showed this egg and a person who's having hair fall. Can anyone tell me how it is related is? So think for one. Yes. Okay. What I wanted to tell is those persons who are eating this raw eggs. Okay. Raw egg. So that persons can have this particular deficiency called as hair fall. Yes. Because the raw eggs contains, yes, anyone think the raw egg contains something called as avidin. Okay, when you have to take the egg only in the boiled form. I hope everyone knows it. Okay, you have to take the egg only in boiled form. Yes, but persons who are not actually cooking the egg properly, and they will actually break the when they are taking from a farm and they are buying, and they are just breaking the egg and drinking the egg content. For that particular persons, it can lead to many things, not only heart fall, and it can lead to also food poisoning because salmonellosis infection from the chicken egg directly rests there. So that is the reason to prevent this salmonellosis infection also food poisoning. We need to cook the egg. Okay, boil the egg. Only boiled egg only should be taken. On the other hand, if you are directly drinking that, another problem can occur. That's a hair fall. Why? Okay, is this raw egg contains a chemical called as abidin. Okay, that inhibits your biotin absorption in your body. That can indirectly result. Many studies have checked. Dermatologists are saying that I have checked I have scanned all the body parts and I couldn't find the reason for your hair fall. Okay, this is the last reason diagnosis of exclusion you can find in case of your thing called as egg deficiency because of this vitamin deficiency caused due to the intake of raw eggs. Okay, this deficiency is more common. Okay, I am telling this again. This is a diagnosis of exclusion. Okay, the last point you need to know that abidin inhibits in present in the raw eggs can affect this. Okay, and to summarize, I want to tell that like different groups of vitamins. Okay, you need to know the scientific names, source, functions, and deficiencies. Okay, so to revise this, vitamin A, remember like carrots and green vegetables. I will cover in the other class as well. Carrots are more rich in vitamins. If it is deficient, it leads to night blindness. B complex is mainly present in your five things. What I told. Remember milk, yeast, egg, green leafy vegetables. Okay, all these things are vitamin B or complex. If it's not there, mean you will lead to muscle weakness or body weakness. Vitamin C in citrus foods leads to scurvy deficiency. Vitamin D, you know that egg yolk fish, and it deficiency leads to rickets and osteoporosis. Okay, like that. You need to know, remember these four headings as a summary part. So, any questions you can want to ask? So, I have completed the class. Any questions or queries you can ask me directly in the chat box. Okay. Now, if there are no questions, we can directly proceed to our assessment part, like MCQ quiz. Okay. I wanted everyone to keep it, remove off your video screens and mute off your mics and just type the answers in this platform. Okay. Let's see how many answers get this correct. So, MCQs. White polished rice causes a deficiency of yes. Yes, I'm able to see the answers. Yes, very good. It is thiamine. White polysaccharide causes a deficiency of thiamine. And next, is caused by, again, yes, it is D2 deficiency, riboflavin deficiency. Yes. Can we proceed to next? Pellagra in MACT population is caused due to, yes, anyone? Yes. I'm able to see the answers. Yes, it is due to excess of leucine. Excess of leucine blocks the conversion of tryptophan to niacin, and that is the reason for the deficiency of niacin leading to pellagra in maize eaters. Okay, read the question carefully. A farmer is having the complaints of skin rash, which increases on sun exposure. There is also redness in his tongue. Maize is staple diet. Which vitamin can be the deficient? Yes, think for a minute. Read the question very carefully. Yes. So B3. Why B3? B3 is niacin. So that condition deficiency leads to condition called as hyperpigmented patch over the sun exposed site. That is your Kessel's necklace. Okay, which this deficiency is more common in farmers having the complaints of skin rash. There is also a redness in tongue aspect. Maize is a stable diet. Already it is B3 niacin. And now we will actually, I will show some pictures. Now I wanted to tell that which vitamins are rich sources. I have projected some pictures. I want you to tell which vitamins. I will show some pictures like what is the first picture? It is orange. So tell me which vitamin is rich in orange? Yes, vitamin C. And next, what is the picture? Yes, it is pink eggs, looking like eggs now. So which vitamin is? Vitamin B complex. And next, so what is the which vitamin is rich in carrots? Yes, vitamin E. And sunlight. Obviously, you know that it is vitamin D. Okay. And now we'll play a small game like connecting the dots. So I'll be showing some pictures. I want you to see the pictures very carefully and tell me what these pictures finally mean to a single answer. Okay. The first picture is, yes, looking like iron folic acid tablets, na? Yes. Next is, think for a minute, think. Yes, it is Goba like, okay. Next, what is this? Yes. So it is looking like a swollen bleeding gums, na? Yes. And this particular gentleman is James Lind. Okay. Anyone can guess? Yes. Very good. Yes. This particular vitamin is called as vitamin C. Okay. Vitamin C is an answer. Okay. So thank you for listening this class. So, okay. Thank you. So now it's time for taking our attendance. And so now we will close the session. Okay. Thanks for listening. Okay. Thank you.